Hey guys, we're going to go over some of the palpations for the knee and the thigh. So let's start with the bones. You want to start with the patella, which is right here. You can palpate the different poles of the patella, so superior and inferior, the medial border and the lateral border. Okay. You do have several bursa sacs that are around this area, and those can get injured really easily and have a lot of local swelling from those. Okay, from here you've got the patella tendon, which goes down to the tibial tuberosity right here. You've got the quadricep tendon up here, and all of your quadricep muscles that are coming from the thigh will filter down into this quad tendon, and it turns into the patella tendon and attaches to the tibia. Okay, we've got the joint space at the joint line. If they've got pain that's deeper inside here, then it could be some of the internal structures like ACL, PCL, and meniscus. Okay, we can palpate the joint line. If they have pain along the joint line, then that could indicate that there's a meniscus issue. We have a plica band right through here on the medial aspect, medial to the patella. Okay, some people have a plica band that's on the lateral as well. It's not as common. We have the MCL right here where the tibia and the femur meet. It's part of the joint capsule. On the lateral side, we have the LCL. Find the femur, the epicondyle, and the head of the fibula, and it's between those two structures right there. On the posterior, you can palpate the hamstring tendons, and we'll look at those a little bit closer here in just a minute. All right, and then obviously the femur, it's in the middle of the thigh and it goes up to the hip. So let's do some muscle palpation. So go ahead and scoot back and lay flat. Okay, we'll start with the quadricep muscles, and the quadricep muscles are going to filter down into the quad tendon right here. You need to find the hip. I usually find the ASIS, anterior superior iliac spine. Okay, and whenever you drop down about an inch, then you can find the beginning of the rectus femoris, which is originating on the AIIS, anterior inferior iliac spine, and it's going to go down to this quad tendon. So if you find ASIS, AIIS, just walk your way down. That's all rectus femoris down to the quad tendon. Now deep to the rectus femoris is the vastus intermedius, and it's going to be on the shaft of the femur. It does not cross the hip joint, and again, it's deep, but it goes right down the center, vastus intermedius, to the quad tendon. Okay, you've got vastus lateralis. If you find the greater trochanter and go just distal to that right here, okay, that's going to be the vastus lateralis. It's still quadricep muscle, it's just anterior lateral, and it again goes over to this quad tendon area. The vastus medialis is going to be on the medial side, okay, and it's going to go down anterior medial aspect to the quads, to the quad tendon. So those are your 4 quadricep muscles. Now, if you on that box, if you want to see where the adductors are, it's a little bit harder to get to, but the adductors are going to go from the pubic bone over to the femur. And I told you guys to remember this by the phrase, Paul likes Abby, Allie, Maggie, and Gracie. Okay, Paul is for pectineus, which is the shortest one, and it's right here. He likes Abby, which is adductor brevis. He likes Allie, adductor longus. He likes Maggie, adductor magnus, which goes down to this adductor tubercle right here. Okay, and he likes Gracie. And Gracie comes down and attaches right here to the pes anserine on the tibia. Okay, along with the sartorius, and we have one other. Oh, it's a semitendinosus right here. All right, so those are your adductor muscles. Go ahead and roll over so we can do the hamstrings. For the hamstrings, the tendons for those are going to be right through here Okay, you can palpate those really easily if you have them go into a little bit of knee flexion. You say, hold, don't let me push you down. So don't let me push you. And they'll start to poke out at you. You can feel those a little bit easier right here. Okay, so go ahead and relax. The hamstrings are going to originate on the ischium, which is deep in the gluteal region right here. Okay, 3 of the 4 originate up here. One of those, the biceps femoris, the short head of the biceps femoris, is going to be on the shaft of the femur. Okay, it doesn't cross the hip joint, but it's going to go from here down to the head of the fibula right there. The long head of the biceps femoris goes up to the ischium, so it crosses the hip joint. But again, it's just traveling the same line down to the head of the fibula, which is right here. Okay, then you have semimembranosus and semitendinosus. The semimembranosus is the deeper one of the two, and the membranosus again is going to go from the ischium down the medial aspect of the thigh, and it's going to go to the posterior aspect of the tibia, so it's about right there. Okay, the semitendinosus again originates on the ischium, goes down the medial side. It sits superficial to the membranosus, but it's going to wrap around right through here and go to the pes anserine on the anterior side, which is one of the ones I pointed out to you just a minute ago. And that's it for your muscular and bony palpation of the thigh and knee.